So, what is my plan for the day? Um, there we go. I'm going to just do a very brief review. Now, I know that the majority of you have heard all about stem cells and you've heard about exosomes and growth factors, and that's the very reason that we've invited you to join this program, is because we know you are all in your own rights dedicated people in terms of your knowledge and your skill sets when it comes to managing skin. But I'm going to just really touch on a few key points which I think will clarify as to why we're so excited about this technology and also where it fits into the bigger world of exosome technology. You know, literally over the past 10, 15, 20 years, there have been literally thousands of publications published on the role of exosomes, on stem cells, and this is by no means the end of it. We're going to be hearing a lot more of this technology, and we're seeing more and more exosome technology coming through to the market, enabling professionals like yourself to bring about some real exciting change in skin. So we're going to share our view, and we're going to share what our product offering is all about, and then ultimately roll into what we are proposing for a protocol for this actual experience. So we're going to talk a little bit about the biologics. There are a couple of great alternatives and options, and we want to position very clearly the role of SCCME within the context of the biologics that are currently available, specifically in South Africa, I think. And from there, we'll talk a little bit more about some of the theories. And if you have heard them before, it's a great recap. And ultimately then onto the differentiation of our actual product. So if we consider for a moment the quiver of tools available to a skin professional to correct age or photo-aged skin. You know, we have lasers and we have injectables and peeling solutions, and many of those have been used for many years and very successfully. However, what I'm referring to specifically are the biologics, the biological agents which are being incorporated into aesthetic medicine to bring about robust changes in the appearance of photo-aged or intrinsically aged skin. Now, of those biologics that you would have heard and probably seen a fair amount of in the market, you know, the obvious is, of course, growth factors. We've been working with growth factors for 17 years now. So recombinant human growth factors are certainly not new, however, still very relevant in the space of treating photoaging or age correction, as we refer to it. PRP, platelet-rich plasma, is, of course, really gained some fantastic traction. The availability of kits to more conveniently extract the supinants and to remove the activated platelets and either re-inject or to introduce them via needling or post-fractionated laser is certainly not new, but very relevant, and I think still very exciting and to some extent unexplored in what they can achieve. Stem cell conditioned media, fairly new in the professional space. And by that, I mean stem cell conditioned media was used predominantly in wound care clinics and, you know, to address chronic non-healing wounds in the diabetic ulcer contexts. We're seeing that spill over into day-to-day use, as you've seen with our current Refirm products. Autologous fat is a wonderfully bioactive material. There is a huge amount of variability in success rates with autologous fat. I'm talking now about extraction and re-injection. Autologous fat drawn from a patient and re-injected can have tremendous benefits and has shown fantastic results. A very invasive procedure relative to the convenience of an injected hyaluronic acid filler, as an example, but yet it is a biologically active material, which we certainly cannot exclude from our list. The use of stem cells, well, that in itself has certainly been more so in cardiology, in orthopedic surgery, and also to some extent in neurology, where the use of reimplanted stem cells to regrow tissue injured through trauma, disease, some form of pathology has been looked at for many years. And as you'll see later on in the presentation, stem cells themselves aren't always that predictable. They have wide variability in terms of their viability in tissue, in the host tissues, and certainly are still very much the domain of orthopedic surgery and, as I said, cardiology, which has been using them for many years. And then finally, the big buzzword, exosomes. I can't think of a single anti-aging congress that hasn't had at least a third of their agenda dedicated to this wonderful topic of exosomes. And it's this very topic that we're focusing on moving forward with our presentation and, of course, in our experience program. So lots of biologics, some more convenient in the clinical context than others, some more accessible than others. But what we're hoping to do is kind of distill down to a product or a treatment offering that we believe will give the treater a range of biological effects that is convenient to access, convenient to use, safe to use for better age correction results. So if we talk stem cells for a moment, I think it's important just to remind ourselves that stem cells are everywhere in your body. Mesenchymal stem cells, by their very definition, are stem cells that exist in the support tissue of various organs, and they themselves lie in that state undifferentiated, and it would take a triggering event to activate that stem cell into a target cell. So, for example, a mesenchymal stem cell could be derived from a host of different tissues, and you can see from the slide that, ranging from dental pulp in your tooth, breast milk even, and endometrium, they're everywhere. And the question is, are some better than others? Are some more active than others? There's been a lot of talk about bone marrow-derived stem cell technology and how this might be different or better than, placental-derived stem cells. I think the point is when we talk about exosomes, as we'll learn later on, they're a subfraction of the secretome that come from stem cells, and the source then becomes less and less relevant when you're talking the exosomes versus the actual stem cells themselves. So we don't want to confuse people with, oh, we've got this source of stem cell versus that, which one's better. We're talking about the exosomes now, and the exosomes derived from these various host tissues are actually biologically very similar in their activity, which I think is a very important point to make. Mesenchymal stem cells in their own right are very useful in that they are hypoallergenic. They don't tend to trigger an immune response by the host, and this has something to do with the types of proteins that are expressed on their surface. And we call this the major histocompatibility complex, and there are a variety of proteins that can be expressed on the surface of a cell as part of this family. Stem cells tend to express very few of these, which makes them very useful to either transfer across species even, but certainly they don't always have to be autologous, drawn from the patient to use back in the patient. They can be sourced from a variety of hosts. They are fairly simple to use, and I say that in a very important context, that we're talking about biologically viable tissue, and they need to be kept alive, kept healthy, kept metabolizing. But the point is, the mesenchymal stem cells have been used for a fair portion of time, and there are multiple sources that they can be derived from. Now, the exosome themselves, the stem cell themselves, when applied onto wounds or injected into areas, have seen to have a variety of biological benefits, which are important when it comes to skin. And more and more, as you'll see in a few slides' time, the understanding is it's not necessarily the stem cell itself, but rather the substances that stem cells secrete. These tend to be, more importantly, the activators of a variety of effects in skin. So the cell itself is becoming sort of less important, and the focus is now on what it can produce, what it secretes out around it in a paracrine fashion, meaning that the stem cell can communicate with surrounding cells and bring about biological change in those cells. It's that secretome, or range of secreted substances from stem cells, which are now seen to be the more important part of this entire process. So in terms of effects within the skin, notably, they've been shown now in several studies to have some key important changes which we're most interested in. And of course, anti-aging therapy is probably the most topical. Their ability to enhance regeneration of an aged skin is phenomenal, in that they can upregulate a variety of growth factors to be secreted by cells and induce large quantities of new collagen, but also very importantly is to modulate that collagen production by producing MMP, which we've always known to be, matrix metalloproteinase, always known to be the destructive enzyme in skin. And indeed, that's its function. However, when it comes to anti-aging, we must recognize that it's important that in some instances we have to remove old tissue or damaged tissue. And this will be done through these matrix metalloproteinases. And stem cell conditioned media, which contains a variety of agents, including exosomes, have an ability to regulate this. In other words, they can help remove some of the damaged tissue, yet at the same time also regenerate new tissue. And that fine balance is exactly what we're looking for when it comes to remodeling a damaged dermis, for example. However, the effects of stem cell conditioned media and their associated exosomes go beyond just aging. We've seen dramatic results in patients with atopic dermatitis, where exosomes are able to significantly suppress the pro-inflammatory cytokines associated with the condition by modulating the effects of white blood cells. In wound healing, we're seeing much faster flap repair. We're seeing much quicker regranulation of tissue, and this is by and large due to the secretome. So the focus on what stem cells can produce has really become more important than the actual stem cell itself. And trying to modulate these stem cells is something that we've spent a fair amount of time focused on. Our particular choice of source tissue is, of course, adipose tissue. And the adipose-derived stem cells are extremely versatile and, believe it or not, rather robust. They can take quite a punch without necessarily being or down-regulating or becoming less biologically active. So to give you a sense of how we do this, essentially it has to come from a biological source. So, of course, human tissue. And these volunteers are screened genetically to ensure that there is no underlying disease state, cancer state that can be detected using a variety of DNA or arrays, which can pick up any form of genetic defect in the host tissue. Once cleared, these patients are then have a sample of adipose tissue removed via liposuction. And this lipoaspirate, as it's known, then goes through a series of processes whereby it is cleaned. In other words, you're removing blood and muck and all those other parts of bits of cellular debris, and ultimately you're ending up with what's known as the stromal vascular fraction, the SVF. And the stromal vascular fraction contains around about 500,000, 500,000 stem cells per gram, which in itself is rather impressive. But what we do then is put this through an entire process whereby we go through amplification, whereby placing these stem cells in certain types of condition or culture media, we can amplify their growth. So we can encourage them to divide and increase in number in a fairly short space of time. So through the amplification process, we're literally jumping up to 10 million stem cells per mil, which is an incredible increase in concentration. Once they've been amplified, we then need to try and get these stem cells to secrete the secretome, the substances with which that they're capable of producing. Now, this stimulation process is done using hypoxia. Actually, you lower the oxygen concentration within the culture, and this hypoxia induces a degree of stress, if you will, to the stem cell, and this encourages them to secrete all these proteins into the surrounding culture medium. So this stimulation process is really, really important because it's how we can source the growth factors, the exosomes, and as you'll see later on, a variety of different biological agents. Having done this, what we then do is we take the process through isolation, where we can remove all the stem cells, all the proteins, or all the cellular debris. We're essentially cleaning it up. So what we're left with is quite literally a purified form of the secretome. All these elements that the stem cells have produced under this stimulation process. And this stem cell conditioned media is now what we've been using in the production of our Refirm product line. And of course, you'll know about the Refirm serum and of course, more recently, the Refirm elixir. And now you'll see how this folds into the third product in the professional context, which is our SCCME solution. So a very, very lengthy process, but at the end of it, we're dealing with absolute liquid gold in how we've able to isolate and concentrate these very important biological elements. Now, again, to re-emphasize that the focus is not the actual stem cell itself, but rather what it secretes actually was discovered more so in the field of cardiology, whereby patients after after a heart attack with damaged or dead myocardium tissue or heart muscle, in order to try and regenerate new muscle that could contribute back to contractility or pumping of the heart, stem cells were injected into the tissue. And interestingly enough, what they found is that these stem cells were actually not very active. They tended to fuse with host cells, and they couldn't find a very clear link between the injected stem cell and new myocardium being produced. And it was through these studies that it was ultimately discovered that it was the actual secretome, the actual substances of the stem cell, that was more important than the actual cell itself. And this is why you don't see us producing topical stem cells that you can apply onto skin. Firstly, they can't absorb. They're too big. They're macro in size. However, the secretome and its soluble proteins and exosomes are tiny and have the ability to absorb through skin far easier. So we're not producing an injectable form of the stem cell conditioned media. We're not at this point producing injectable exosomes, because we know that we can still get vast degrees of absorption through the skin based on the actual size of the secretome agents. So let's just give some context to, or rather, let's give a name to all these tiny little elements that I'm actually referring to. If you look at the diagram or the graphic, you can see that the mast cell represented, the stem cell represented as the green, amorphous structure. The stem cell actually, through a process of, it's endocytosis, so it forms tiny little bags of proteins, of microRNA, of messenger RNA, growth factors. These are collected inside the stem cell, and then these little containers, which we call vesicles, are then pushed out into the external environment. This is a process called exocytosis. So through this, you're left with, on the left-hand side, soluble growth factor proteins, cytokines that are floating freely in the solution. But you're also finding these vesicles, these tiny membrane-bound bodies within the secretome, and there's a variety of them. Exosomes are characterized by their size. So in order to determine how many exosomes we have, or whether there are, in fact, any exosomes, we use what's known as nanoparticle tracking analysis. And this allows us to measure, using light diffraction, the size of the actual vesicle itself. And we can isolate those vesicles of very specific size and remove the others. So we have much larger vesicles that these cells produce, which biologically are of less relevance. But what we do is we collect in our stem cell conditioned media all these elements of the secretome. So we have growth factors, cytokines, lipids, proteins, and we have exosomes. So from the beginning, our stem cell conditioned media, our Refirm serum, has got exosomes. They derive from stem cells. They already have exosomes in them, and you'll see I'll quantify them for you a little bit later on in the presentation. So exosome, it's not as though we're now suddenly producing an exosome product. We've had an exosome product all this time with our stem cell conditioned media. And then, of course, in our elixir, we were then able to use this technology and quite fancy encapsulation magic to keep these exosomes stable and put them into, in this case, a moisturizer. So this breakdown of various components, microvesicles versus apoptotic bodies versus exosomes, let's don't get confused. Essentially, these are all tiny little membrane-bound bags of which contain a variety of different elements. So if we looked at the anatomy of an exosome, it's certainly not the prettiest looking thing on earth, but there's some important points to be made from this. An exosome is surrounded by a membrane. So in other words, everything inside that vesicle is protected from the external environment. And we can identify exosomes not just by their size, but also by the types of proteins that they express onto their surface. So you'll see from the diagram, and I'm sorry that it's a little complex, but just bear with me. You'll see that these things called tetraspanins, and they're essentially tiny little proteins that are on the surface of the exosome and also have a tiny part sticking into the inside of the cell. There are different types of tetraspanins, which we call CD receptors. And there are certain CD receptors which are characteristic for exosomes only. So just by measuring the amount of CD receptor, we can determine whether we're actually dealing with an actual exosome or if we're dealing with a much larger vesicle or a part of the secretome that we don't really want. Where am I going with this? It's very possible to isolate exosomes because they can be identified. And they're identified by not just their shape, not just their size, but also by the presence of very unique surface proteins. Why is that important? Well, if we can identify them, we can concentrate them. If we can identify them, we can remove those elements we don't want and keep behind exactly what it is we do want. So concentrating exosomes, identifying them, we've got this down. We've got this. And now it's a case of, well, what's inside them and what can we do with them? Well, they contain an incredible quantity of proteins. You can see I've just referenced some numbers underneath that. I mean, almost 10,000 different proteins inside each exosome. It's ridiculous. We have messenger RNA, which of course is RNA capable of triggering a genetic event. They are the software program that will tell a receiving cell what to do. MicroRNAs, they're just slightly different. A microRNA regulates transcription, which means they control whether a gene is actually read and converted to a protein or whether it's not. They can switch things on and switch things off. That's microRNAs. And then a whole bunch of signaling lipids. So these are different lipids that are capable of not only binding to and getting into cells, but these lipids can also trigger biological effects in target cells as well. So essentially, an exosome is a biologically active ball or vesicle. And it is capable of not only surviving outside of a cell, it is capable of identifying and attaching to a target cell. It can enter that host cell. And very importantly, because of the presence of all these mRNAs, these messenger RNAs, they're able to reprogram a target cell and change its effect or change its activity, excuse me, and in some cases even switch them off. So they're very, very versatile little signals that the body uses to communicate. And finally, we're at a point where we can harness this power of these exosomes and put them into your hands to help you help your client address specific concerns with aging. So, wow, a lot said in a short space of time, but exosomes really have earned their reputation. Not part of this talk, although I'd love to chat more about it. Exosomes in the future, I believe, will be used to treat cancers very successfully because you can program the surface of the exosome with certain proteins so that they can seek and attach and enter specific cell types. So exosomes in the future will be programmed to identify cancer cells, whereby they can bind to, enter, and kill a cancer cell. So even as a future form of chemotherapy, these biologics have got tremendous potential effects in modern medicine. And I think we're only seeing the tip of the iceberg in what we can do with these. But coming back to today's topic, we're dealing with the exosomes derived from stem cells from adipose tissue. And these adipose-derived stem cell exosomes have shown to be very, very efficacious in terms of producing new blood vessels. You'll see functions below that. They can help build new blood vessels. They can help normalize cell turnover. They can suppress inflammation beautifully. And they can also strongly upregulate certain proteins like procollagen 1 and 3 is a perfect example. So we are going to reprogram your skin by using software produced by stem cells, and they're going to be delivered using exosomes. So I kind of hope that gives us a nice overview and a context of where this whole thing comes from and where it's going. Now, a little bit more about the harvesting of these exosomes. They are essentially, they're available in, I suppose you could say, two major formats. If you take stem cell conditioned media derived from, as I said, stem cells, they will by default contain exosomes. I mean, your saliva contains exosomes, breast milk, they're everywhere. It's about the concentration of these exosomes that's important. So if you take regular stem cell conditioned media, there are already exosomes in there. So that's the one format that they can be presented in. The other one is that you can say, okay, let's take the conditioned media, take out everything else, absolutely everything, and only have exosomes, nothing but exosomes. In order to do that, you have to take them through a filtration system. And I'll show you in a moment that there are a variety of filtration methods available, and some more useful than others, some take a lot longer than others. But ultimately, it is possible to concentrate down to quite literally dried lyophilized powder, just pure exosomes on their own, nothing else. These are then typically reconstituted with a solvent of sorts to put them back into liquid phase, and then this can be used to treat patients. We've taken a slightly different angle on this. What we've decided to do is we've decided to keep a base of the stem cell conditioned media, but to concentrate our exosomes beyond what you would normally get in the conditioned media. We've taken that and we've concentrated and increased in number the number of exosomes that you would find. So we're kind of using a hybrid process where we're giving you far more exosomes than you would get in just conditioned media on its own, but we're still keeping some of those base proteins and cytokines, which are so useful for skin, as well in the process. So our SCCME, I would call a bit of a hybrid in that it's not one or the other. It's a blend of the two technologies, concentrated exosomes, but still keeping the benefits of the stem cell conditioned media for treatment. Now, in terms of isolation, it gets very technical, but I think what I'm trying to demonstrate to you is that there are a host of ways in which you can try and remove the exosome from conditioned media and have just isolated exosomes. Some of them are extremely laborious. They take a long time. Some damage the exosomes. Some waste a lot of exosomes. And very few give a high yield of purified exosome. Well, of all of these techniques, we're using the density gradient ultracentrifugation. And this technology is very time consuming, painfully so. But what we find at the end of the day is that the exosome viability is high, meaning they aren't damaged and they are intact and they are operational. So we've chosen this particular isolation technology to try and boost our exosome numbers as opposed to a long list of others. So is there only one way to do it? No, there are many, but we've chosen a particular technique that we believe is far better in the yield that we ultimately get. Our solutions we then put through NPT, nanoparticle tracking analysis, and what this does is to 100% confirm that we've got exosomes. Now, exosomes by their definition are between 50 and 100 nanometers in diameter. Now, size-wise, let me give you context. That is anything between 5 to 10 times smaller than a single wavelength of visible light. They are minute. And you can see from high-powered electron microscopy on the right-hand side under B, you can see these tiny round spheres, which visually confirm the presence of an exosome. But very importantly, on the left-hand side, the NPT shows us exactly what the size of that vesicle is. And at 66 nanometers, we're sitting smack bang in the range of 50 to 100. These are exosomes. So how do we know they're exosomes? Because we measure them. And, how do we know they're nothing else? Because nothing else is the size. And anything bigger, we can remove. Anything smaller, we can remove. And that is the concentration technology that we're using in the production of SCCME. Now, the effects on the skin, oh my word, this is literally, as you've seen from anti-aging congresses, this is potentially days worth of topic. So I'm going to just try and briefly summarize for you. If you look at the effect of these extracellular vesicles, in this case exosomes, you can see that they have very specific effects on certain target cells. So on blood vessel walls, for example, excuse me, on fibroblasts, keratinocytes, and as well as immune cells within both the epidermis and the dermis. And without going through every single one of these, what I can point out briefly is that they have an immune regulatory function. In other words, they can down tune an overactive immune response. So that's why they work so well for atopic dermatitis or in these inflammatory conditions, especially chronic wounds where there's a lot of underlying chronic inflammation. They can, suppress this and they can start turning it down, not switch it off like you would with a powerful topical glucocorticoid, but certainly to help regulate the immune response. Very good for re-epithelialization. In fact, probably one of the first benefits, as I mentioned earlier, for these technologies was for wound care, and the ability to speed up the regranulation of the epidermis is notable. Within the dermis, the remodeling of the dermis, the extracellular matrix, as well as the increasing the number of proteins produced, such as collagen type 1 and 3, is astounding. We get far more fibroblast migration, so fibroblasts will differentiate and move into the area of injury much quicker in the presence of these vesicles. And very importantly, on the second last point, scarless healing. The use of these exosomes has been shown to reduce the severity of scar formation, and a very complicated process, but essentially all it does is it changes the ratio of transforming growth factor beta 3 to beta 1. This ratio is what determines whether you're likely to be a keloid sufferer or not. Well, these exosomes help re-regulate some of that and reduce the likelihood of hypertrophic scarring, which is exciting for wound care. And then finally, for blood vessels. Of course, aged skin is known for its damaged capillaries within the dermis and poor ability to supply oxygen and nutrients to the target tissues. Well, with the use of exosomes, we can actually reprogram growth of new, healthy, intact capillaries within the dermis, which helps, of course, with some of that healing. So summarized out, we can see that exosomes have a variety of benefits. The melanocyte inhibition, I've put it in, but I don't want you to get your hopes up on this. It's by no means it's by no means going to switch melanocytes off. They can brighten skin, yes, that's true. But it is fair to say that if you use conventional tyrosinase inhibitors, they would be more effective in blocking pigment. But the point is, it is an additional benefit that they can reduce MITF regulation or transcription. Of course, that's a gene found in the melanocyte, and thereby help with skin brightening effects. But as I've already alluded to, regulating inflammation, magic. Collagen synthesis, the ability to address vessel formation, and of course, ceramide production. Very, very good for the atopic dermatitis patient. Here's some examples of brightening of exosomes, and you can see that the reduction of melanin over periods of time is certainly very effective. Bearing in mind that if you were to use an alpha-arbutin or a peptide specifically made for pigmentation, you'd get a better brightening effect. So I'm not going to propose this as its primary effect, but it's a nice add-on effect on the skin. Erythema is where this really shines. This particular study was using fractionated carbon dioxide laser, and you can appreciate that the redness associated with the procedure subdues a lot quicker than what you would get with normal conventional therapies of barrier support and so on and so forth. And of course, this speaks to the ability to suppress inflammation. I mentioned atopic dermatitis. Well, just to suggest that exosomes are capable of upregulating ceramide production. On the left-hand side, you can see as you increase the concentration of exosomes, you get this very significant increase in the production of total ceramides within the epidermis. On the right-hand side, you will see a variety of pro-inflammatory cytokines, interleukin 4s, interferon gamma, interleukin 17, IgE even. And as you increase the exosome content, these values drop. So great stuff for reducing inflammation, great stuff for helping restore the barrier of photo-aged skin. We know that takes a beating, as well as all the other benefits I've mentioned. Exosomes certainly have a wonderful future in addressing age correction. There have been quite a few studies looking at aging, the very indications I mentioned earlier, and these publications time and time again have shown the same sort of benefit. Be they derived from adipose derived or bone marrow stem cell derived. The point is these exosomes have got a consistent effect on the skin that have really proven themselves with time. So it's not as though you're dealing with experimental therapies, stuff that no one's ever seen or used before. They've certainly proven themselves. It's now availability. It's how easy can you access these darn things, and they are by no means easy to get your hands on, and certainly affordability is a challenge. But we've hoped to address that with our new offering. Using them topically, this was a very exciting piece of data, which we weren't surprised to see, although this was using stem cell conditioned media, bearing in mind they do contain exosomes as well. This is the first in vivo study which showed significant improvement in photoaging using stem cell conditioned media. Now, I want to point out that this study only used 1% of stem cell conditioned media. That's rather low. We've obviously opted to go far, far higher in our product offerings. But the point is, again, to give you the assurance, the reassurance that you're dealing with technology that is biologically very powerful, but it's safe, it's effective. And more recently, a study showing that, or looking at a toxicology analysis of just exosomes themselves, came back as we expected, showing totally safe for topical therapy. Now, I want to point out, that these studies were considering the toxicology of exosomes applied topically. These weren't studies for injected exosomes, but the point being, what they did was check whether the exosome had the ability to cause toxicity in target cells or to change and mutate cells to produce cancers, for example. These were all part of this analysis within the study. And what they showed is that absolutely no adverse toxicological effects on skin. And in fact, the study came out promoting and suggesting that exosomes would be a fantastic ingredient choice for topical and or cosmetic or biological uses. So the data is there. You should have complete confidence in the fact that this has been looked at and has been looked at extensively. We're dealing with proven technology, but just really hard to get your hands on. And that was for us the major impetus to try and provide a solution that could be used in a professional context, associated with conventional in-office treatments. And that led us to the development of our SCCME solution. So again, what is it? Well, it is certainly based on adipose-derived stem cell conditioned media. But as I explained earlier, what we've done that is unique and different to the current offerings out there is that we've taken the stem cell conditioned media, which in itself is 100% pure. There is no additional elements added whatsoever. 100% pure stem cell conditioned media, and we've now boosted the exosome content. We've concentrated these exosomes in the solution, so you're kind of getting an exosome therapy and a stem cell conditioned therapy combined into one. Now, we've made it such that it can be reincorporated. You can dilute it down. You can cover larger areas with it. We've given you huge flexibility in how you can use this solution. And that's part of why we needed an experience program to say, okay, let's give our valued supporters, those people who we know are really dedicated to improving skincare, let's give them the opportunity to experience this firsthand. Of course, within the stem cell conditioned media, you still have all those cytokines and growth factors, which we've all come to know of in our training. And in this case, we've kept all that goodness. We've just bumped up the exosome content. Now, I hear you say, but what's the concentration? Well, I've tried to give you, again, using a nanoparticle tracking analysis, we obviously have to verify the content of our exosomes and our proteins in all our products. And we do this for every single batch to make sure that there's consistency of quality. And that would then, of course, bring around consistency of effect. But if you look, for example, at our very first product, which was the stem cell conditioned media, the Refirm Serum, there you're looking, I'm talking exosomes now, you're looking at 4.8 billion exosomes per mil. Now, that's a lot. In terms of availability of other exosome-derived products, it's well within that concentration range. Within the elixir cream, we have 1 billion. Now, the reason why there are fewer exosomes in the moisturizer than there is in the serum is because we have to make a moisturizer. I needed space. So I need emollients and I need surfactants, emulsifiers. I need everything to create the actual delivery system. So that takes up space in the formula. And so we have fewer exosomes based in that than you would in, for example, the serum. But if you look at our stem cell, our SECME, well, now we've taken this to a whole new level, because here you're looking at roughly 27 billion exosomes per mil. So it is most certainly concentrated, and that combined, as I said earlier, with 100% pure stem cell conditioned media, this is an absolute powerhouse of a product. Now, the way in which it's presented is inside that little carton, you have two 1 ml vials. And within that, the solutions are all produced in a pharma grade lab, and it's all sterile, all sterilely closed. It all meets all the requirements for GMP or good manufacturing practice production. Within that, you have a vial filled with 100% pure boosted solution. And it is that solution that we can then either dilute down using saline to various volumes that we can use depending on the treatment objective. So those two 1 ml vials in each one of those cartons is what constitutes our SECME. Now, how do we deliver this to the skin? I hear you think and maybe ask. All studies to date really looking at exosomes for certainly aging and age correction have used some form of transepidermal enhancement. So in this case, this study, in fact, published 2 months ago, I think, looked at using either microneedling or fractionated CO2 laser. Of course, that's an ablative laser, so it creates channels within the skin, much like a microneedle creates a channel, just a different mechanism of achieving that. And this study was comparing whether microneedling or fractional carbon dioxide laser, how that impacted the absorption of the exosome and also how that changed the result. And I was quite astounded, actually, given that fractional CO2 is an ablative treatment which creates a thermal injury beyond just the ablation of the column. You'd expect it to have absolutely wiped the floor. But interestingly enough, over time, the microneedling, the fractional CO2 combined with exosomes yielded very similar effects. And although some patients preferred fractional CO2, some people preferred microneedling, it was sort of a mixed response. But ultimately, the evaluation of clinical outcome showed that the exosome effect is fairly indifferent as to which mechanism you choose. If you do have fractional carbon dioxide lasers or erbiums, or whatever the case is, you can use fractionated CO2, fractionated lasers. If you currently use needling, you can use needling. It would appear from these data that this doesn't cause or doesn't set you back in terms of potential outcome or efficacy. So the choice of delivery option is yours. Can you apply it directly onto skin without having any pre-treatment with needling or fractionated laser? Of course you can. They are extremely small, as I explained their size. They absorb beautifully through the epidermis. You probably would guess that your total dose load would obviously be less. So we personally think that the positioning of SECME goes really, really well with either needling or fractional lasers. And that is kind of how we've drawn up our protocols moving forward. We believe the client would get the best result with the combination. Now, the time frame, we're going to be sponsoring 2 patients or 2 treatments for 2 patients. So we really are trying to give you as much experience here as possible. Because the patient would have been pre-treated with retinoids, they have treatment 1 at the start of the program. A month later, okay, because we're recommending a 1 millimeter penetration, be that through laser or needle, we would like a 1 millimeter depth, please. We don't go much less than 4 weeks. We're not into that. We believe the skin needs time to recover and heal. So first treatment, they're going to get needling with the SECM. A month later, they get treatment 2, SECM and needling. 2 weeks after that treatment, they're going to come in for a light superficial chemical peel. And this one, we're going to be providing the Lactoferm 3010 just to enhance epidermal smoothing of the corneum. And then right at the end, we're going to have, of course, our evaluation at day 56. So that's just under 2 months of time in which the client is undergoing their treatments, feeling the great effects of the product, and at the same time, they are being taken care of with support products, which we will provide. Now, these protocols will be given to you. My team will go through them with you in painstaking details, so I'm not going to hold us back any longer than I need to. Oh, I've got 2 minutes. But I think that paints the picture fairly clearly. The actual mechanism or the method of doing the treatment, hey, I'm preaching to the choir here. You have incredible experience in your technologies. I'm merely going to add one element in, and that is when we use the SECME, if we're doing face neck décolleté, we've estimated that 2 mil will be the ideal quantity. Now, 2 mil means we're going to take one vial of 1 cc and we're going to reconstitute that with sterile saline to make a total of 2 mil. That volume is what you will use for the treatment. The second vial will be for the client's second treatment a month later. If you're unsure about how to reconstitute, our team will show you how to do that and exactly what type of saline. Do not use saline for injection. That stuff will burn the hell out of you. Just normal 0.9% saline, and we'll show you and tell you all about that when we sit with you on the protocols. So at the end of the day, and I've made it just within the stroke of an hour, we are introducing something that is unique in that it's a hybrid of technologies, known technologies, but we've been able to integrate the two together. We've put it into a format that is accessible, it's available, it's very user-friendly, it's very safe, and it's very effective. We now want to give you, the people who we have built such long-lasting relationships with, an opportunity to really get your nails sunk into this and enjoy the experience that you will be providing these clients. And that was the purpose of initiating this particular program. And we hope that you will then get some great feedback, which you can give us as well. And at the same time, walk away with an experience of something truly innovative. And we pride ourselves on producing and presenting this innovation to you. So for us, it's a perfect partnership of taking results forward for consumers. So with that strike of 1 hour, I'm going to hand back over to Nicole, and she can coordinate subsequent. But so far, thank you so much for listening, and I hope that's made sense. Nicole.
That was excellent. Thank you so much, Dr. Bradley. Karen is going to assist us with questions. So I don't know if anyone wants to raise their hand, they can just let us know, or they can type it in the chat. And then Karen will just be able to help you out with that one. So over to Karen. Thank you.
Hello, everybody. I doubt that I can see on my side that I cannot see the chat box. So you are all welcome, or when you want to ask a question, you should be able to turn your sound on. If you can just stick up your hand, I can help you with that. Any questions from anybody? There's a little hand that looks like that. If you just raise your hand, then I can see it. Everybody good? Rowan, are you able to? All right, let me just see. Rowan, are you able to turn your sound on?
I am.
Here we go. Fabulous.
So thank you, Dr. Bradley. Thank you, everybody. I naturally have got some quick, curious questions that I just want to have. You were talking about the concentration of the exosomes per, is that deciliter you were talking about?
No, that was per mil.
Per mil.
Yeah, that was total cell count per mil.
Cell count per mil. And I just wanted to ask you, because obviously I've had an interest in PRP and I do offer PRP treatments. I wanted to know if you were able to give me some sort of comparison between the concentration of using plasma from an extraction from a vein compared to this. It's just out of curiosity that I'm really asking that question.
And yeah, thank you so much, Rowan. That's a great question. And I kind of had this inkling feeling. So I actually have some more slides. Excuse me. This is the slide I wanted to share with you, Rowan. The difficulty in quantifying exosome content in PRP is it's entirely dependent on how successfully you've been able to activate those platelets using, calcium citrate or whatever the case is, and the means by which you can, or the degree to which you activate the platelet, will often affect yield. So to quantify an exact a number of exosomes per mill is not necessarily that easy, because the prototype or the protocol for extraction of the PRP and the activation thereof and the activation agents can vary. So the quantum of exosomes I can't give you off the top of my head, but what I can show you was a study that came out comparing the PRP as you would have otherwise derived it from the patient versus concentrating the exosomes out of the PRP, if that makes sense. What this study showed us is that if you look at PRP, and I'm going to refer you to the right-hand side diagram, I'm sure you can see that. This is looking at wound closure post-treatment with either, an alginate, hydrocellulose alginate system, which is the SAH, versus PRP derived using the conventional protocols versus the exosomes derived from PRP. And what they were able to show is that although PRP was superior to alginate and certainly better than control, it was actually the exosome load in the PRP that seems to be driving most of the effect, than as opposed to the entire solution itself. So the outcome of this trial or the study was, if you could isolate the exosomes in your PRP, you would probably have a better result than you would on just straightforward PRP alone. Not to saying that straightforward PRP is not good. It's fantastic. It's been well validated. It's just a question of what component within the PRP is actually driving it. And again, it is believed to be from the exosomes. Now, this exosome load took 4.5 hours to isolate beyond just making the PRP in very specific conditions. So it's by no means something we can just quickly do in our clinical context, and needs to be derived in a laboratory before it can be applied practically. But in terms of total quantity, some of the data that I have seen so far on PRP that has been recentrifuged a third time was that you're looking per 10 ml volume, you were looking at 80 billion exosomes per 10 ml. So that brought you down to 8 billion exosomes per mil, but that hadn't then been additionally concentrated. So it's probably double that of our serum, but it's a little bit less than our ACCME in terms of total exosome count.
Okay. Thank you.
Pleasure.
I understand the quantifying difficulty with whatever you're using, because I do know that some practices don't use the calcium citrate to actually activate, and I've also heard that some places don't always centrifuge for long enough, and sort of situations like that are definitely going to change the outcome for your clients.
Totally.
If anyone else wants to ask a question, because I've got one or two more that I'd like to ask.
Okay, if you can ask your next question. I don't see any other hands up, so ask your next question.
I just was interested to know the price difference between, obviously we know the prices for microneedling, but I don't offer CO2 laser. So are those must be quite, there must be quite a big difference in price between offering a microneedling compared to an ablative laser or CO2 laser. Am I correct in saying that?
Oh, yes, absolutely. The number of centers in South Africa that currently offer ablative fractional lasers, I think, are fairly scarce. I know there is some non-ablative fractional laser going around, but of course that sort of defeats the point. We're trying to create channels through which we can deliver far more content of product. So your direct question, price, yes, absolutely. Fractionated ablative lasers are pretty pricey. I'm sure Karen might be able to give insights to what she might know of the current market costs of these things, but far, 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 far more expensive than needling. So I think from a cost effectivity point of view, there's no doubt that needling still will remain the clear choice in most instances, certainly in the South African context, from a pricing point of view. I have some colleagues over in the States who run very, very large practices where they only use fractionated lasers, but it's so available and the relative costs of performing those treatments are, pretty good. So it's contextual, countries, availability, the types of expertise available. But I think that overall, the components of performance treatment are, of course, a little more expensive than vitamin C or a typical hyaluronic acid meso solution. That is true, but one way to contain that cost would be with a more cost-effective option such as needling. And I suspect that's where most patients will likely go to in this experience program. That's my expectation personally. Karen, I don't know if there's something you want to add to that.
I completely agree, but I do think that in both cases, it is about improving your results and your downtime for your client. So we're offering something that we can combine with our fractionated laser treatments that will increase results, will increase effectiveness of our treatments. Of course, there is an additional cost to both.
The last thing I wanted to ask was, if one wanted to use red light therapy, although I must be honest, since I've changed over to using the Nova pen, I find that my clients, even when I'm working at a deeper depth, have very little redness. They are red initially, but within that, even less, within 24 hours, I'm finding that my clients are quite excited to be able to go back to work. They don't feel like they've had any sort of quite dramatic treatments, whereas before I found my clients were very red and puffy. So I'm not finding that with the Nova pen. So I must compliment you all on that, because I think I actually wondered whether I was doing it properly, because my clients were just looking so amazing after their treatments. And but it was just a question that I'm interested in asking. And would you say that red light therapy post-treatment is an option for these clients, or would you say that's a bit of an unnecessary thing, since the results after microneedling are so minimal with regards to redness and puffiness? Obviously not for everybody, but for a lot of clients it is.
So I'm assuming that Bradley wants to answer that, but I would ask that you don't do red light in this trial or in this experience program. It's not a trial, it's an experience program. Okay. So what we want you to experience is gold standard from Lamelle. So what we can offer and see the change there. Your clients that are not on the program, definitely, we would always suggest light therapy. It's in your unit, incorporated into your treatment protocols. It does make it more comfortable for the patient. And especially, I find that there's that one that's always red. I would definitely suggest that you add that onto that client. But for this experience program, just to reiterate, if you could just use what we are offering, that would be really, really great. So that there's no doubt about the result. That's really what we want, with the space that we want to create this time.
Dr. Bradley did say that we're not creating a competition between treatments and different things. So I agree.
No, absolutely. I think that we have to, we would openly admit and accept that there are very effective treatment programs out there for patients with a variety of concerns. And we, that's fantastic. And we're not for a second trying to say, you see how much better we are, aren't they terrible? No, that's not what this is about. Okay. And I think that's important to point out, that using LEDs, we know that they are biologically active. We know that biologically they do increase mitochondrial ATP production, and that there's definitely a consequence to that. And to Karen's point, what we don't want to do is just muddy the waters with co-therapies that themselves are, biologically active, because then we can't say this was the SCCM program. Could it have been a little bit of the laser? Could it have been a bit of that? So outside of the initial treatment, which could either be needling and or fractionated ablative laser, outside of that, we want the program to run as neatly as possible.
Absolutely. I understand. Thank you very much.
But if I can interject, sorry, Rowan, there is one important point that, of course, I must mention. To Karen's comment, if you do have a patient who happens to be extremely red, or you're worried about erythema, then by all means don't withhold therapy. If you feel that red light is indicated in this instance, for heaven's sake, go ahead. We're not asking you to do anyone a disservice by withholding therapy should it be indicated. In the event, let's say hypothetically, someone develops a superficial infection subsequent to needling, that they're going to need therapy. They must get treatment. First, do no harm. And it's if everything's running according to program, that we would ask you to keep the program as neat as possible.
Absolutely. Thank you.
Fabulous. Thanks, Ron, for your questions. Any other questions? Bradley, any other comments?
No, I think I've jabbered on enough, and my throat's starting to turn all sorts of funny. So that's me for the morning, and perhaps just a wrap up to say thank you to all of you. Of course, you may choose not to participate in the experience program, but you're by no means compelled to have to do so. It's entirely at your choice and your discretion. We're just inviting you. If you do choose to participate, I hope that you thoroughly enjoy the journey with us. We're very, very excited to bring this to consumers. We're very happy to give you this experience, which I think you would enjoy both professionally as well as for the outcome of your clients. And for that, we're very excited as well. So thank you for your time, and thank you for your dedication to ongoing skincare and learning more about it. We certainly see eye to eye as far as that goes. So I wish you all a wonderful day further, and my team will be in touch with you. Karen will undoubtedly do a fantastic job of mediating this entire program, and I look forward to feedback as we go along. So thank you so much.
Thank you very
Fabulous.
much.
Nicole, over to you.
Oh, no. I just wanted to say thank you for everyone for joining us today. I have recorded this, so anyone maybe wants to recap, we will send that out afterwards. But yes, looking forward to the journey. So have a good day further, everyone. Thank you so much.
Bye-bye.
Bye-bye.